This is the Fix Your Sciatica podcast.
And welcome back to the podcast on how to fix your sciatica pain without the use of medications or surgeries. Today, we're going to be addressing how to manage your sciatica pain when you are driving or riding in a car. And being in a car can be excruciating, especially for you listeners. Today, we're going to be talking about specific strategies on how to make it more tolerable so you can get from point A to point B. But here is the catch. There's no one-size-fits-all solution to this. And so your ideal sitting position is going to be depending entirely on why you have sciatica pain. So we have to start off by figuring out the cause of your sciatica pain. We don't have to solely rely on those MRI results. Instead, we're going to be focusing on your clinical presentation. And what that also means is, how do your symptoms behave? Does your pain worsen when you arch your back? Does it improve when you round it? Does the pain seem to originate more from your back or from your hip? These are the clues that we need to know in order for us to be able to get a better understanding of how we can sit with a little bit more or a little bit less pain. Now, my method for sciatica pain treatment is based on three major principles. The first one is going to be correcting or shifting your posture, symmetrical and balanced before we do anything else. Number two, we're going to be focusing on more exercises, stretches, and positions that actually make your pain feel better. And then we're going to avoid or modify the activities that actually increase or trigger your pain. And so the three principles above will actually indicate the cause of pain, ideally helping us differentiate between the pain originating from our low backs or the hips. So if you respond well to back extensions or leaning into the side of pain or arching, most likely you're dealing with what I like to call a disc herniation or disc irritation. If you respond well and better to forward bending or leaning away from the side of pain, you're most likely dealing with arthritis or stenosis. If you only feel pain with motion, you're either dealing with core instability or you're doing the movement wrong and it's putting a lot of pressure and irritation in your back or your hip. Now, if you identify that there's no back motions that actually change your pain, then it makes sense for us to actually move further down the chain and look at your hip itself. But let's get back into sitting in the actual car itself. The goal is to create a sitting position that actually evenly distributes your weight across your thighs and your buttocks and minimizes unnecessary movement at your low back. We're going to be adjusting three key areas, which include your seat height, your backrest angle, and the distance from the steering wheel. So first, we have the seat height, and this is crucial for hip positioning. Ideally, we want your knees flexed to about 90 to 100 degrees, and so think about it as being nicely grounded. If your seat is too low, your hips are going to be bent a little too much or flexed too much, and if you don't have enough hip flexibility, then your back is going to round in this scenario, which isn't great for some folks, but is actually fantastic for others. If your seat is too high, then you might actually be unstable. You won't be able to reach the pedals properly, and your pelvis might actually tilt too much, causing, again, irritation in your low back. Ideally, you want to be able to feel like your weight is distributed evenly across your thighs and not too much in one area or the other. The second component is going to be the backrest angle. And this actually directly impacts your hip angle as well. So if your back prefers extension or arching, interestingly enough, you might find that a 90 degrees of hip flexion is going to be most comfortable. That means that you're going to be sitting a little bit more upright. You might need a little extra support, so if that's the case, you can grab a lumbar cushion and put it in between your back and the seat. But if your actual spine prefers more rounding, you might actually want to lean back a little bit more, be a little bit more in the reclined position. And realistically, you can actually experiment and be the judge on what makes you feel the best. And finally, your distance from the steering wheel is going to dictate how you feel as well. And this is it's not just about comfort, but it's also managing sciatic nerve tension. So if stretching your foot forward actually aggravates your pain, it might actually make sense to move your seat closer to the steering wheel so you can bend your knees a little bit more. This reduces the stretch on the sciatic nerve. Now, in addition to actually sitting in the car, we have to talk about the things that you need to do before and when you get out of the car. So here are going to be a few simple movements that can make a world of a difference to get you ready to sit in the car with less pain. Number one, if your back prefers extension, you're going to want to do about 10 standing back bends, a gentle arching motion, and all this is going to do is going to prepare your spine. So then that way you can sit for a little bit longer. If needed, you might need to get up a little bit more often during your drives to apply that backward stretch to give yourself a little bit more opportunities for extension. Now, if your back prefers a little bit more flexion, you might actually need to do much before getting in because sitting is going to be relatively in a flex position to begin with. Now, regardless of your back preference, I find that actually deep hip stretches are essential. So think about a deep lunge hip stretch or a simple knee to chest stretch. These are going to help loosen up those hip flexors, which can contribute to sciatica indirectly. Now, after you get out of the car, you can repeat the stretches that actually align with your symptom presentation. If you prefer extension, you're going to do a little bit more standing back bends. If you prefer flexion, then a simple knee to chest or a toe touch can be helpful as well. One thing that you actually don't need to worry about when you're driving is actually trying to strengthen your core. While core strength is actually important for overall back health, trying to engage your core when driving or sitting is going to actually do much. You're passively supported, so focus on positioning and those pre and post ride stretches. Remember, sciatica pain is extremely individualized. There are going to be some trends and patterns that we're going to see, but it's important for you to listen to your body, experiment with these adjustments, and find out actually what works best for you. And if your pain is severe or consistent or persistent, always consult with a healthcare professional like doctors, physical therapists, or someone like myself. And so that's it for today's episode. I hope that you navigate these car rides with a little less pain. And so until next time, take care and drive safely.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.